Good morning, good afternoon, good evening, everyone. Thank you very much for joining us today. Today we are on our monthly webinar for August. We have a team from MSH that is going to be speaking to us about flexible digitalization of regulatory authorities. That you could make the time. Next slide, please. So as you may abstract has gone out. So annually we do the GDHF forum, and this year the forum is going to be on 4th to 6th December. It will be in Washington, DC, and it will be a hybrid forum. So the call has gone out. Submission deadline is on the 25th of this month, which is tomorrow. So this is to call you all to really turn in your abstracts and ensure that you don't get locked in. The theme has remained the same this year, is driving effective and equitable digital health innovations. You have a link on the slides that will be shared. If you want more information or need to submit your abstracts, there is the link. In case you have any questions, there's an email address that you can see under questions there. Please do reach out and we'll respond to you. So on to the exciting part of the webinar, I will hand over to the MSH team. Ashley, take us on.
Thank you so much, Rose. Good morning, good afternoon, good evening, everyone. My name is Ashley Sorgi. I am a team lead for our data and digital health work at MSH, and I will be the moderator for today's session. We would like to start this session out with a poll, which should be coming up shortly. But this is perhaps a new topic for some of you, and we have some questions about your familiarity with national regulatory authorities, if you've engaged and worked with any authorities in your country, if you know what a regulatory information system is, and if you've worked with one before. So if you could please take a few minutes to fill out the poll, and we will see those results popping up. So far, I only see 8 responses, but it does seem that a majority of our audience does know about national regulatory authorities, and a majority of our audience knows which agency regulates medicines in their country. I think we have less familiarity with regulatory information systems, as well as using those. So those responses are very interesting. I think maybe we'll give it a couple. I think we have 11 responses now. Just give it 20 more seconds for any. I think our data trends are holding strong. Great. Okay. Well, this was really helpful to our presenters. I think it will help give them an idea of maybe some additional areas to focus on. I will end the poll and share the results. You can see those. So we do have the majority knowing about NRAs, and then there is less familiarity with the RIMS systems, which we will talk about a lot during the presentation. So I will stop sharing that. and then move on to our slides. So I will review the first couple of slides and then hand it over to Kim for his part of the presentation. So just a quick overview of our agenda today. We've gone through the introduction. We'll be talking about what is a regulatory system first, describing the challenges within working in national regulatory authorities. We're very happy to be joined from our colleagues from Bangladesh and the Philippines to talk about their experiences with product registration and pharmacovigilance, and some progress in other countries as well. And then we will end the presentation with a vision of a harmonized RIMS regulatory information management system, and hopefully have time for Q&A. I'm going to jump into just a brief introduction. So there's lots of acronyms and to learn within this presentation. I just want to start out noting Management Sciences for Health, the organization that we all work for, just their mission. So we work with countries and communities to really improve the health and especially health systems of the most vulnerable populations. So our work really focuses on building strong, resilient, and sustainable health systems. The Medicines, Technologies, and Pharmaceutical Services MTaPS program. So you'll hear reference to that throughout the presentation. Much of this work was funded under that project. And the focus of that project is to really ensure access to safe and quality assured medicines at affordable prices. There's a long legacy of work in this area. So you might have heard about previous projects, the SciAps project, which was the previous years. And so that work has really cemented a lot of the pharmaceutical system strengthening or PSS approach that both MSH and the MTaPS project have worked in, and we've had a pivotal role in that in terms of health system strengthening. MTaPS is implemented by a consortium, and so we are blending together experience from our prior USAID projects and with local expertise to implement these programs globally. So I will now introduce Kim Hoppenworth. He is a principal technical advisor who works on the MTaPS team and an expert in regulatory information management systems. Kim, over to you.
Thank you very much, Ashley. I will take us through a number of slides. I'm happy that the big part of the audience has a good understanding of regulatory authorities. I can see we have been joined by some colleagues from around some of the regulatory authorities in the world. So yeah, without further ado, I will take us into the slides. So what is a regulatory system? I will go briefly through this and then focus more on the information system. But in general, any national regulatory authority is part of a governance system and focus on three elements of the health sector. The people, meaning the owners, or it could be owners and staff of wholesaler establishments, pharmacies, importers, exporters, manufacturers, etc. We have premises, wholesalers, pharmacies, and manufacturers, etc. And then we deal with products, which can be medicines, medical devices, health supplies, including laboratory items and supplies. From the WHO website, I found a small quote here in regards to the functions that a national regulatory authority caters for, and it states that marketing authorization and post-marketing surveillance and adverse events following AEFI monitoring are functions that all NRAs have to establish. And the NRAs also approve clinical trials in a country. And lastly, the regulatory authorities do collaborate at both regional, continental, and global level. We will get a little bit into that data. But essentially, you can describe the work at a regulatory authority with getting input from clients. And in this case, the clients would be some of the people that have been mentioned here. They can submit an application for a product marketing authorization, as an example. They can also, patients or healthcare providers can submit a report on a suspected adverse event. That then goes into the National Regulatory Authority. They have processes in place, workflows, SOPs that describe these processes that they use to deal with the input. And then as an output for the authority, you will have a permit, which could be a marketing authorization. It can also be PV analysis that would show signal detection of a suspected drug event. We will share all the slides after the presentation here, and then you will be able to access the links provided in the presentation too. So what is the challenge at the NRAs, and how can we support that? The WHO has the global benchmarking tool in place, which accelerates the transformation of national regulatory authorities into more functional authorities with effective regulatory systems and control of the medical products market. The WHO global benchmarking tool measures the maturity level of a regulatory authority, and based on the results of the indicators, an improvement plan is made for the regulatory authority. Part of that transformation requires that the NRAs establish clear regulations, guidelines, procedures, and that they have a number of different reports available to the public. That could be a list of products in a country with a marketing authorization. It can also be to ensure that there's functionality available to be able to analyze and do signal detection of adverse events, so that is communicated to the public as soon as it's established. The challenge is to then have a solid regulatory information management system in place, which can automate and support these procedures, which could be for marketing authorizations, as mentioned, can be import licensing, of course, the pharmacovigilance, and clinical trial approval, and a bunch of other permits, so to speak, that a regulatory authority must establish. So what are the benefits of then implementing a RIMS for a given regulatory authority? So a high level of automation at an NRA results in a lot of regulatory benefits. It means that there will be sufficient data with high quality available to do analysis and help decision making. It will increase the traceability, accountability, and transparency and good governance. It will provide adequate access to statistical evaluation. So that's a lot around the pharmacovigilance, where we have a lot of data and complex analysis. It will overall decrease the processing time and thereby increasing the access to safe and high quality medicines to patients in a country. We have seen a number of these benefits, as mentioned. The MTaPS program is coming based on the SciAps program, and we did have some good analysis back then that solidified the reduced processing time at an authority, and also transparency and access to the statistical evaluation. What we want to do further is to enable and empower the NRAs to adapt and use modern technology with no or low code to address these challenges. What does that mean? That means when we are looking at a piece of software, we want to make sure that it's adaptable and configurable for a given country without necessarily having to involve a software developer. So that's what we want to do, and have an international or an international version available of the software that can then be configured, much like you have DHIS2, OpenRIMS, and a number of the other tools out there in other areas. And then in addition to having that available, which also matches the localization requirement from USAID, we also want to ensure that we use the power of business intelligence for decision making and eventually pave the road for artificial intelligence and machine learning in regulatory affairs. Especially looking at where you have a lot of data and complex data. So what we are looking at right now is applying machine learning for the pharmacovigilance part of it. Two parts that we will be talking about, just repeating again the people, premises, and the products. I think with the background here, people, our colleagues here are aware about that. I will briefly mention the technologies that we have been using to establish the OpenRIMS platform that we are presenting. The main technologies applied is Java for the registration module, Angular and C# for the pharmacovigilance module. Then we are using a number of different cloud services to get it all up and running. And then for the power, for the business intelligence solution, we have been deploying Google Looker Studio to increase the data use and have dashboards and all of that. For the interoperability, we have deployed GraphQL to ensure that the system is open outwards, so we can use the data in other systems. And then further to support the platform, or to support the software, we also have a media wiki available for all the documentation, user manuals, etc. We have a discourse forum available for discussion and sharing experiences, knowledge, challenges, and all of that. We have a Moodle instance available that caters for e-learning. And then lastly, the main website is based on WordPress. There I will provide the links further in the presentation here. This is an overview of the platform where you can see on the top here, we have the main website available, the e-learning, the wiki, the forum, and then the two modules for registration and for pharmacovigilance. And then the last one down here called GitHub is where the source code resides. And it's a global platform and community to support deployment, development, and sustainability of OpenRIMS. In this case, the software can contribute, as mentioned, to increase the global benchmarking tool score and thereby the maturity level of authorities. The software is provided as free and open source, so everybody and anyone can access the application and the code on the GitHub. It is built to run on minimal system requirements, which means you can do rapid deployment in 2 to 3 days is what we have done with in a number of cases. I think we have 5 or 6, 7, something like that, different cases up and running. And the benefit of getting it up and running in the cloud is that as we get that deployed, we can start the configuration or localization of all these processes as decision of procurement of local servers are going on. The system is designed to scale, so we can add additional processes as they come up. So just briefly before we go, I hand over to our country teams. I'll give you a small global overview and some illustrative screenshots of what the system actually looks like. The country overview here explains initially about our active surveillance module and spontaneous reporting, where it's been deployed and what it's been used for. In the Philippines, it was initially used for bedaquiline, and they will be presenting today in terms of where they are now. Mozambique has been using it over the last 5 years for TLD and for TPT regimens. and Rwanda has been using it for the dolutegravir regimen and for Ebola vaccine. For the registration module, we have actively launched that in Bangladesh for vaccines biosimilars and for the yellow card to collect adverse events. They are also presenting later today, and we are happy to have them here. For Nepal, they are set to go live in a few weeks, so that's very exciting. They have a very broad deployment with both pharmacy registration, product registration, manufacturer registration, etc. And for Madagascar, we are looking at the marketing authorization specifically for a group of products under an organization called Salama. So that's where we are. What does the system look like? I'll start with a screenshot of the dashboard. We are using, as mentioned earlier, the Google Looker Studio dashboards, where you can, with a few clicks, get to an overview. In this case, we are trying to illustrate the identifying a bottleneck in the marketing authorization process. So initially, you will choose the given process or workflow. In this case, it's the workflow for marketing authorization. And then you can click the column here, which has the average number of days that it takes for a given step in the process. And then you can, with those two clicks, easily identify the bottleneck in the process at the regulatory authority. So it can be used for management purpose to ensure that we can provide the support needed at the given step. The next interactive dashboard is developed from Nepal. It's also Google Looker Studio, and we have maps there. This is particularly useful when you are doing inspections of pharmacies. So you can click a different region, and then you will get a list of the pharmacies that are due for inspection in the next month or two. Lastly, here we are illustrating the configuration of the common technical document format in the system. All what you see on the screen here can be configured. As I mentioned earlier, we want to have no or low code. The process illustrated up here is adaptable inside the browser when you're logged in as a system administrator. So you can add, remove, change the title, the text of each of the steps here, and the content or the electronic form that is then linked to each of these steps. The system also runs in multiple languages. We have it in English, French, Nepali, and more languages can be added as needed. The last illustration here, before I hand over to Bangladesh, is about interoperability. We are working closely with the teams in the countries to ensure that we have interoperability with VigiFlow, that is using what's called E2B, and the system, the Pharmacovigilance module generates the E2B file, which ensures that we can submit the information to Uppsala Monitoring Center in Sweden for further analysis and global aggregation. So that's a lot of information. Again, we will be sharing everything and links and so on. So I will hand over to our Bangladesh team. Thank you very much.
Yeah, thanks, Tim. Hello, everyone. Good morning, good afternoon, good evening. This is Abul Azad working for MTaPS Bangladesh Country Office, supporting the DGDA, the National Regulatory Authority here in Bangladesh, in strengthening regulatory system. I will start with a background. You know that the National Regulatory Authority is responsible for assuring quality, safety, and efficacy of all types of medical products, including vaccines. And one of the priority of the government of Bangladesh is to achieve the WHO maturity level 3, and that's why DGDA faced a formal inspection back in 2021. And at that time, the WHO assessors they identified a lot of challenges related to the lack of automation in DGDA regulatory processes. And then DGDA came up with a request to MTaPS to support them in addressing those challenges. I mean, addressing the addressing the challenges related to the automation, and MTaPS put those requests in their work plan and then submitted to the USAID, and USAID was kind enough to approve that work plan. And here you see the screenshot of the DGDA website showing the digital systems we from MTaPS recently introduced. First on the Pharmacovigilance Information Management System, Kim was saying about that, and also the DGDA RIMS, that is OpenRIMS. DGDA renamed it as DGDA RIMS, that is a DGDA Regulatory Information Management System. So both systems are live and accessible to the public. So moving to the next slide. The slide shows what we have done so far and the next step in terms of Bangladesh DGDA digitalization. I was talking about the Pharmacovigilance Information Management System, that is PVIMS. So before introduction of PVIMS, we have gone through a lot of stages. For example, we have gathered the requirements, then validated the requirements by from the DGDA. Then we designed the process flow, and then we got the process flow approved from the DGDA. Started customization of pharmacovigilance based on the process flow approved by the DGDA, and then we demonstrated to the stakeholders, including WHO, and we got some feedback. We addressed those feedback, and again we demonstrated to WHO, and it was accepted. And then DGDA approved the product, that is PVIMS, for go live. Then we conducted comprehensive training to all the stakeholders involved, and then we conducted a user acceptance test for them. After that, DGDA issued an administrative letter for granting the 5 marketing authorization holders to use the PVIMS for adverse event reporting, and it was in May 27, 2023. And the system currently has received 110 reports as of today, and 29 of the reports have been evaluated thus far. And regarding the DGDA RIMS, we followed the same procedure before its implementation at DGDA. I mean, we followed the same procedure for its development, like PVIMS. And so far, the DGDA RIMS, that is OpenRIMS, received 4 applications, vaccines and biosimilar products, and all the applications are going through a review process of DGDA, and MTaPS is supporting DGDA in that. And you see here the screenshot. Kim showed the screenshot as well. Here you see the CTD module structure embedded in the system. We customized based on the country requirements, and then also as required by the WHO assessors. And the system, that OpenRIMS, can generate the marketing authorization certificate automatically. So it is the endpoint of the open application evaluation. As next step, actually, DGDA is planning for scaling up of both systems. A few days back, WHO arranged a workshop here in Dhaka, involving 40 marketing authorization holders, and PVIMS is the product that was demonstrated that time to all the stakeholders, and it was found to be acceptable for scaling up across the country, with some minor feedback. That feedback is now being addressed by MTaPS, and hopefully by from October, the scaling up process will start with DGDA. And another thing is, about the EMC from Kip's presentation. DGDA is the 120th member of the WHO EMC, and it has mandated to share the adverse event information with the WHO EMC. And as we are currently receiving adverse event reports through PVIMS, so there is a need to integrate these PVIMS with the WHO EMC VisiFlow. The VisiFlow is a, that it's a country container provided by the UMC. So we are in the continuous communication with the UMC authorities, and WHO, the headquarters team, they're also supporting us for this integration. Hopefully, within very short time, we'll be able to integrate PVIMS with VisiFlow. Regarding transition, as you know that MTaPS is approaching the closing in the next year, September. So both DGDA and MTaPS are working hard for smooth transitioning of both systems. And DGDA is in the process of identifying a pool of master trainers so that they can train their own staff beyond the MTaPS period. And DGDA, they have an IT cell, and we supported them in strengthening their capacity. And we also proposed budgetary allocation in the next sector program of the government of Bangladesh, so that DGDA can manage their own fund to implement further implementation of both systems and maintenance. And we would like to hand over both tools with source code, manual, and server in the next year before we close. So we have a lot of benefits we are experiencing here in DGDA, real-time assessment and instant decision making we can do using the system. Applications reports are at which stages can be traceable with just one click. Audit trail is active, so any manipulation could be identified easily. That promotes transparency, and everyone's responsibility can be monitored in the system. That improves accountability as well. Many more benefits actually DGD is having. Kim showed dashboard in his presentation. With the live dashboard, you can see the average days taken for registration application, and where is an application stuck. DGD also they can identify and take some measure. And some information should be readily available in public. For example, the product summary characteristics, the approved or rejected vaccine list. It is the requirement of WHO GBT. So these are also available in the dashboard. So it complies the WHO requirements actually. So I'm moving to the next slide. So we have learned a lot of lessons from Kim's presentation. We understand that the OpenRIMS is an open source software, and which is very much flexible. And DGD's intention is to expand the DGD RIMS, that is OpenRIMS, to other regulatory functions as well. And there is an IT cell in the government. And if you can form an IT cell and provide them training, then definitely the implementation of digital systems will be smooth. So it is one of our actually lessons that we learned. Because you know that the government people they are a little bit reluctant using IT infrastructure or something like that. And another lesson is before customization of any digital system, manual regulatory processes or procedures should be robust or as per standard. So MTaPS experience is a little bit bad in this regard because we had to change our workflow in the system several times because the process was the manual process DGD was following was not that much standard that is not that didn't comply with WC requirements. So we helped to fix that problem at DGD, and after that we restarted, you know, customization of the OpenRIMS for DGD. So, and yeah, to avoid delay in implementation and reduce cost, manual processes should comply with standards first. And the last lesson we learned about the impact on WSO GBT requirements. As you see in the WSO-GBT, many indicators are related to the EMA management information system. I can talk here about two functions, that is pharmacovigilance and marketing authorization. The indicators VL5 and 6 talk about automation, that is mechanism exists to promote transparency, accountability, communication, and also the performance indicator, the regulatory processes and database for application received, reviewed, approved, rejected, suspended, or withdrawn. So these are the two examples of that kind related to WSO GBT indicators. So both of our systems meet the indicator requirements of WSO GBT. So implementing both systems actually contributed to increase in its score of WSO GBT for DGDA towards attaining maturity level 3. So here you see two photos that show WSO's participation in successful demonstration of OpenRIMS and PVIMS for DGD. Thank you very much. Over to you, Ashley.
Patrice, over to you for your slides.
Yes, thank you so much, Ashley. Good morning, good afternoon, and good evening to all. I am Patrice Cabasis. I'm the PV Technical Advisor from the Philippines. So I will be presenting our experience in the use of PVIMS. So first, let me give you a background on why and when PVIMS started in the Philippines. So PVIMS is an open source tool developed with the technical support of USAID. At that time, it is SciAps and now MTaPS. It was implemented last 2015. It was initially implemented in the 10 selected PMDT facilities to support the active surveillance of the 9-month treatment regimen and bedaquiline operational researches. So with these two researches, we captured 12,000 plus adverse events, and it was managed accordingly. So where are we now? Then PVIMS was then adopted by the Department of Health, Disease Prevention and Control Bureau as a tool to collect and generate standardized active drug safety monitoring data for the new TB drugs and novel TB treatment regimens. So this is to inform the future policy updates on the use of such medicine. So currently, the DOH Pharmaceutical Division is the system owner. Also, currently, the country is collecting and analyzing serious adverse events and adverse events of special interest, um, pharmaceut- um, hmm, Pharmaceutical division, as a system owner, also trained all the PMDT facilities and public health pharmacists. In addition, PD is utilizing PVIMS to conduct causality assessment and generate E2B files to be submitted to FDA. And FDA will then upload the E2B files to the VGFlow for signal detection. Okay. Here is the website of the PVIMS, and also this is the landing page, as you can see, of PVIMS. So on your left, you can see the portals. So we have 4 portals depending on the user accounts that was issued to you. So we have the clinical portal, the analytical, reports portal, and administration portal. So I will be describing each portals in the succeeding slides. So here um you can see the clinical portal. It is used by the PMDT facilities to encode their reports, the adverse events reports. Under the clinical portal, PVIMS has the capacity or the capability to upload laboratory results or other related documents, in particular to the report. As you can see, the names of the patients are reflected in this the initials of the names of the patients are reflected in the system. This is because of the Data Privacy Act in our country. And then for this one, you can see the analytical portal. So you can see the confirm report data, the set medra and causality tab, the extract E2B tab, and the summary tab. So the numbers you can see in each tab is the number of tasks a reporter and analyzer should do. So for example, in the set medra and causality tab, um you can see there are still 52 reports that the causality should be assessed. And for the reports portal, so you can see the reports based on the treatment, adverse events reported, the frequency of the adverse events reported, the causality, the outstanding visits, and etc. For example, under the causality, you can select a certain facility here. You can select a certain facility here. And then you can also set the range of the dates that you want to search. Okay. Um, for a while. Okay. So for the administration portal, this is for the administrations or the system owner. So this is used for the adjustment if you want to add or delete in the future of the fields for the future use For the lessons learned, our country learned that there should be a memoranda that has been issued to report to PVIMS po. So there are several memorandums issued by the Pharmaceutical Division and also by the Department of Health po regarding to the report to PVIMS po. No? So we have also the ease of reporting because of the PVIMS. We also learned that that continuous training of the newly hired staff on the use of PVIM is a must because of the high turnover of the staffs in the facility. And also continuous mentoring and supervision are necessary because of the sometimes of the workload of the nurses in the facility. They cannot remember anymore on how to encode or report those adverse events, and also they can there are times that they forgot to upload or attach the supporting documents. And lastly, continuous training of IDOT's facilities by public health pharmacists and PMDT facilities. That's all. Thank you. Turn over to you, Deane. Over.
Thanks very much, Patrice. Good morning, good afternoon, and good evening, everybody. I'm Deane Putzier, based in South Africa, Johannesburg. So that's middle of the afternoon for me. And by the way, if you hear any jets going overhead, we have a BRICS summit here, so the military are patrolling, so I apologize in advance. So what I'm going to do is describe the vision of what we're doing with the RIMS systems. We have a twofold vision. One is technical, one is operational. So technically, we're looking to build a community of practice. We want to build out our capabilities in the communities wherever we're working, in whichever country we're working, as well as a worldwide community of practice. We have a shared repository on GitHub where everyone can contribute. We will, as MSH, and in conjunction with our two key developers, manage the pull request. Now, all that a pull request is a feature that might be submitted to the main core of the development that we're doing. We really need to grow the teams to technical teams that we have with us. We've got 5 at the moment, 4 to 5 that are working. We have, as I said, two key teams, one based here in South Africa, excuse me, and another one based in the Ukraine, they have immense knowledge in these areas of RIMS that we're discussing today. The other thing is we're looking for continuous alignment with the public digital good. That means it's a USAID funded movement, and we're making sure that we are aligning with the digital good. So everything is open source. Everything we have, our databases are open source, our frameworks are open source. So everything is open source. It's been quite an effort to move it that way, but the teams have thankfully achieved it with great success. So we have other tools available for pharmaceutical system strengthening as well, which are available on the MTaPS web tools page. They cover all sorts of areas from supply chain to asset management. So what is the other part of the vision? We want system strengthening to be the key focus of what we're doing. I see, we are just enablers as information systems people. We just supply the tools that the people that know what they need to do, it just streamlines their processes and helps with roles and responsibilities. So I just see ourselves in the IT or the information systems area as enablers to my colleagues that have spoken before me about what they're doing in the various countries. So our role is, I wouldn't say called ourselves system architects, I'd more like enterprise architects. So we don't get into the detail of telling everybody exactly what they need to do, but we do give broad guidelines of what technologies and what we need as database systems. So we encourage best practices. We use software companies both locally and sort of in the country and in sort of internationally. As I said, we've got key developers in South Africa and Ukraine. And once again, we want to build out this community of practice. We want to share the knowledge that we have in the countries. We're also working with collaboration with the African Medicines Association out in Nepal. We're working to assist with regulatory systems in Africa, and we're promoting what systems should go in. We're not promoting, we're assisting with defining how the system or what kind of sort of maturity level you're at, and what kind of system do you need, how can we help you, and etc. Because software is not a solution to a problem. You need to a process problem. You need to get the process aligned before you can apply software to it, and we just support those processes. The other thing we have in the vision is, to ensure that people or companies apply with common standards when they are developing systems throughout Africa. We went through a big exercise last year with the WHO and PQM Plus and the rest of the community to come up with a set of common standards. As you know, the development is less about technical, but about sharing information. Just an example, if you have one medicine that works on the proprietary system, like a brand name, and then you have a non-proprietary, and there's a many-to-one relationship there. So one doesn't equal one in that situation. So these common standards assist with making sure that we can align between systems. The other thing is we want to expose data for decision-making. Let me share with you one of the systems that we had in one of our countries. It was an Excel spreadsheet that we got, and Kim worked on this. We had 26,000 adverse events, and that's a lot of data, and it's very difficult to process that kind of data. So what then? So we had built this dashboard, which has slider indicators, and we can put the parameters in. So, for instance, if we want people under the age of 23 that have had adverse events for longer than 3 days, we can then define that and come up with a solution here. Once that filter was applied, we found there were 15 patients that had that fit those parameters, and we could then investigate those individually. So that is what data for decision making is for us, and we're trying to make sure that the data that we have bubbles up into these kinds of information portals where we can do decision making on the data. It was an incredible exercise, and well done to Kim. So what are our current resources? We have links here with the OpenRIMS brochure. We have the links to the wiki, the openrims.org, where you can get a direct demo, and you can access to the wiki, the forum, e-learning, demo instances. And the benchmarking tool is a link there as well. So those resources will be in the slides that you get at the end when they get mailed out to you. And then I think it's time for questions, the Q&A. So I know it's quite late. We have only a few minutes for questions, but over to you, Ashley.
Thank you, Deane, and thank you to all of our presenters. This was a very rich presentation with lots of really practical examples of this work, and great to see all of those dashboards and data visualizations that have also been developed. I know we have less than 5 minutes left. I've been tracking the chat. I don't see any current questions that we have. If there are any burning questions that anyone has, please type them into the chat right now so we can respond to them. I think Deane shared that last slide with some resources available for those interested. We will share that slide deck after this presentation. Thank you. Since we don't have any questions, would any of our presenters like to jump in and add any other comments that we might have not covered during the slides?
I will just, thanks to the audience that has attended here. I will share a link for our discussion forum for anyone who wants to contribute to that. And yeah, hope to see you there. And I think you can also contact us via email and so on. So thank you for joining.
Thanks, Kim and Ashley. I'd just like to add that we had a lot of names that were shown on the slides, PVIMS and OpenRIMS. I'd just like to say that OpenRIMS and PVIMS were the previous brand names of the tools we have. PVIMS and Pharmadex, yes. So they've now been rebranded as OpenRIMS RPM and OpenRIMS PVM. So they are just the two modules of one tool that have been evolved. Thanks, Ashley.
Thank you, Deane, for that clarification. Great. Well, I see some great comments about the presentation. Thank you. Thank you for that. I think we can wrap up. We have 2 or 3 minutes left. Thank you so much for the opportunity to present on this work. And I hope everyone enjoys the rest of their days and afternoons and evenings. Thank you.
Thank you very much, Ashley, and the entire MSH team. We are really appreciative. I've learned a lot personally, and I hope everybody else has. So thank you for coming again. And thank you to the facilitators. Thank you to Carrie for always organizing for us these monthly webinars. We have another one that's coming up on the 28th, and it will be facilitated by Jepaigo on tech-enabled PHC, reimagining a client journey. So look out for that. We'll be sending more details and the registration link soon. And again, just to encourage everyone, please join GDHN to become a member of the community. There's a link there that you can sign up for, and you'll be receiving information from the community about what people are learning on the ground, success stories, challenges, etc., that can help with your work. The slides, as had been said before, will be circulated, so look out for that as well. And I hope everybody enjoys the rest of their day. See you in the next month's webinar. Thank you.